with you Dr. Heba Muhammad Al-Hassi, lecturer of Anatomy and Embryology at Mansoura University, and today we will discuss the skull. Skull is formed of 22 bones. 21 of them are immobile and just one bone, this bone, which is called mandible, is mobile. And line of union in between these small bone, this joint, which is fibrous, and they are called suture. They ossify with age. We will describe the skull according to the view we look at. The word view means norma. We mean by that, when we look to the skull from the front, we say Norma Verticalis. When we look to the skull from a side view, we say Norma lateralis. When we look to the skull from a posterior view, we say Norma occipitalis. When we look to the skull from the top, we say Norma verticalis. If we look at the base, we say Norma basalis. If we look to the base from outside, we say Norma basalis externa. And if we cut the skull and look at the base from inside, we say Norma basalis interna. The first one to discuss is the Norma verticalis, when we look to the skull from a top view. In each norma, you will discuss bone forming, sutures present in between these bones, and also general features present. The first bone form the Norma verticalis is the frontal bone, this bone which forms the forehead. And these two bones that present along the side are called parietal bone. And we can see a small part here of a bone called occipital bone, and this part, all this part is called squamous part of the occipital bone. So we see just a small part of this squamous bone of the occipital bone. يبقى frontal bone, two parietal, and a small part of the squamous part of the occipital bone. What about sutures connecting these bones together? That suture which lie horizontally like a crown, it is called coronal suture. And the suture, that vertical suture that unite two parietal bones together, is called sagittal suture. And that suture present posteriorly and connect the two parietal with the occipital is called lambdoid suture. So, coronal, sagittal, lambdoid. What about general features? Okay, this point lays a point of union in between the coronal suture and sagittal suture. It's called bregma, and the bregma is the site of the anterior fontanella in the fetal skull. It closed by the age of 18 months. This point, the point of union in between the sagittal suture and lambdoid suture, it is called the lambda, and it is the site of the posterior fontanella in the fetal skull, and it is closed by the age from the 3 months to 6 months. The highest point of the sagittal suture is called vertex. There are two openings on both sides of the sagittal suture, and these openings are called parietal foramina. Parietal foramina allow passage of the emissary vein. Emissary vein are veins connecting the vein outside the skull, scalp veins, and the dural venous sinuses. Here are two elevations in the parietal bone. They are called parietal eminence, and they are the primary ossification center for the parietal bone. So we have bregma, lambda, vertex, two parietal foramina, and two parietal eminence. This is in Norma verticalis. What about Norma occipitalis? When we look to the skull from the back, we can see these two bones, which are called parietal bone, and this bone which is called occipital bone, and this bone which is called mastoid process. What is the mastoid process? We will rotate the skull to see it clearly. This is the mastoid process. It is a part of another bone which is called Timbrel Bone. So rotate the skull again. There is Norma basalis, Norma occipitalis, two parietal bone, squamous part of occipital bone, and mastoid process. What about suture? This suture is called lambdoid suture. This suture in between the occipital bone and the mastoid process is called occipitomastoid, and this suture that present in between parietal bone and the mastoid process is called parietomastoid. lambdoid, occipitomastoid, and paritomastoid, and we name it by the higher bone. Okay, what about features? This point is called lambda, and also when we see like that, there is elevation here, rounded elevation. As it is rounded, it will be named protuberance. It present in the occipital bone, so its name is occipital protuberance. On the outside, so it is called external occipital protuberance. From the external occipital protuberance descend a vertical line to reaching a foramen here at the base of the skull. It's called the foramen magnum. All this vertical elevation is called external occipital crest. Any vertical elevation in the anatomy will be called either line or ridge or crest according to its height. If it is slightly high, it will be called the line. Higher, it will be called ridge. If the highest level, it will be called the crest. So this elevation is called external occipital crest. We notice that there is 3 horizontal planes. The highest one, and it is ill-defined, and it is called highest nuchal line. And the one that extends from the external occipital protuberance horizontally to reaching mastoid process, it is called superior nuchal line. And this one from the middle of the external occipital crest and lie horizontally to reaching mastoid process, it is called inferior nuchal line. So external occipital protuberance, external occipital crest, highest nuchal line, superior nuchal line, and inferior nuchal line. What about the mastoid process? Rotate like that to see. Here is a foramen, and it is called mastoid foramen, also for the emissory vein. And this depression that we notice here, this groove, is called mastoid notch. This groove is the mastoid notch. This point, which is the point of union in between the lambdoid and occipitomastoid and paritomastoid suture, this point is called acceterion. And acceterion also was opening in the fetal skull, posterolateral opening. Okay, again, there is 3 bones. There is 2 parietal bone and the squamous part of the occipital bone, and there is also mastoid process, which is a part of the temporal bone. About suture, lambdoid suture, occipitomastoid, and paritomastoid. About general feature, external occipital protuberance, external occipital crest, highest nuchal line, and superior nuchal line, and inferior nuchal line. We have here mastoid foramen and also mastoid notch. What about the Norma Verticalis when we look to the skull from the front? First of all, bone forming. This bone is called frontal bone, and this bone is called nasal bone forming the nose. These 2 bones are called maxillary bone forming the cheek, and these 2 bones are called zygomatic, forming side of the face and floor of the orbit. This bone is called mandible. Frontal, 2 nasal, 2 maxillary, 2 zygomatic, and just the mandible below. And we have also here this bone, which is called the layer here from the lateral wall of the nose. We will get closer to it. This bone is called inferior nasal concha, and it is a separate bone in the skull, present, and we can see in Norma Verticalis. Okay, frontal, nasal, 2 maxillary, 2 zygomatic, mandibular, and don't forget the 2 inferior concha from the lateral wall of the nose. What about suture? Suture will be named according to the bone connecting them together, meaning this suture will be called frontonasal, and this suture between the 2 nasal bone will be called internasal, and this suture in between the 2 maxillary bone will be called intermaxillary. And when we look like that and get closer to the other sutures, this suture will be called frontomaxillary. This suture in between the zygomatic and the maxillary will be called zygomaticomaxillary, and this one frontozygomatic. again. We have here frontonasal, this one, frontonasal, internasal, intermaxillary, frontomaxillary, frontozygomatic, zygomaticomaxillary. Now we will discuss general features of Norma frontalis. We have, as we see, 3 large openings. These openings are called orbital opening for our eye, and this opening is called nasal opening or nasal aperture. What about the general features that present in the frontal bone? We have here 2 elevations at both sides, and they are called frontal eminence. Look like that. This one is called frontal eminence, and they are the primary ossification center of the frontal bone. And here above the orbit, at the side of our eyebrow, we have 2 horizontal elevations. They are called superciliary ridges. In between, in the middle, there is here elevation called glabella. And this point, let's rotate the skull. This point at the meeting in between the frontonasal suture and internasal suture, this point is called nasion. And what about the maxilla? Particular feature or general feature of maxilla. Maxilla send a process or a leg or extension joining the frontal bone, and this extension is called frontal process of the maxillary bone. And also sends a process to join the zygomatic bone, so this process is called zygomatic process of the maxillary bone. And this lower border is called alveolar arch. Why alveolar arch? It has a socket like alveoli for the root of teeth. And this alveolar arch, we notice here, this teeth is called canine. And the root of the canine make eminence in the alveolar arch, and it is called canine eminence. And medial to it there is depression, and it is called incisive fossa. And lateral to it another depression, and it is called canine fossa. It also sends here a process to join the zygomatic bone, and it is called zygomatic process of the maxillary bone. We have here an elevation. This elevation related to the nose, so it is called nasal, and it is like a spine, so it is called nasal spine. Present anteriorly, so its name is anterior nasal spine. This one. This one. Anterior nasal spine. What about the zygomatic bone? Zygomatic bone also has 3 processes. A process to join the frontal bone, and it is called frontal process of the zygomatic bone. And this process joining the maxilla is called maxillary process of the zygomatic bone. And this process joining the timbrel bone is called timbrel process of the zygomatic bone. What about the small foramina that present in the Norma frontalis? We have a foramen here above the orbit, so it is called supraorbital foramen. Supraorbital foramen or supraorbital notch. What is the difference? If the lower border of the foramen not present and it is just a depression in a border, it is called supraorbital notch. And if all borders are present, it is called supraorbital foramen. And the 2 are actually present as a variation. And they are the site of passage of the supraorbital vessels and nerve. Below the orbit present the infraorbital foramen for the passage of the infraorbital vessels and nerve. And here in the mandible, here is the mental foramen. Anything related to our chin is called mental. There is the mental foramen for passage of the mental vessels and nerve. And in the zygomatic bone, when we get closer, here present the zygomaticofacial foramen. So supraorbital foramen, infraorbital foramen, mental foramen below here, and here is the zygomaticofacial foramen for the passage also of the zygomaticofacial vessels. And now we will discuss Norma lateralis. We move the mandible to be able to discuss it clearly. The first bone we can see, first we'll discuss bone forming. This bone is called nasal bone, and then frontal bone, and then parietal bone, and then squamous part of the occipital bone. We will discuss them as 2 rows. This is the first row, and the second one is that one. This bone is called maxillary bone, and here is the zygomatic bone. There is a part of a bone called sphenoid, and there is a bone called timbrel bone. What about the timbrel bone? We have three parts. This part that we can see is the squamous part, and this part is the mastoid part, and this is the opening which is called external auditory meatus, and we can see its anterior wall. It is called the tympanic part, and it has also another part, but we will see it from the base. What about suture present? We have this first suture which present in between frontal bone and zygomatic bone, and it is called frontozygomatic. And we have this suture here, closer, this one, between the zygomatic bone and this process of the temporal bone, which is called zygomatic process of temporal bone. So this suture will be called zygomatico-temporal. What about this H-shaped suture? H-shaped suture that present in between frontal bone, parietal bone, greater wing of sphenoid, and squamous part of temporal bone. This suture, H-shaped suture, is called pterion. Here, present from the inside aspect, presents the anterior branch of the middle meningeal artery. So any trauma here will cause injury to the artery and cause extradural hemorrhage. And this part, this union in between the occipitomastoid and parieto-mastoid and lambdoid suture, this point is called asciterion. And in fetal skull, this is an opening, is called anterolateral opening, and it is closed at birth. And also here is opening, posterolateral opening, and it is closed also at birth, or the mastoid opening. And here, or the sphenoid opening. What about general features of Norma lateralis? First of all, zygomatic process. What about general features of Norma lateralis? First of all, the zygomatic bone. It has a process here connected with the frontal bone and is called frontal process. And here is another process connected to the temporal bone forming this arch, and it is called Timbrel process. And the process of temporal bone connected to the zygomatic, this one is called zygomatic process of temporal bone. They will form this arch, which is called zygomatic arch. Let us rotate the skull to be able to see it. There is the zygomatic arch. Okay. What about this elevation at the lower border of the zygomatic arch? This one, it's called articular eminence. This one is called articular eminence. And this depression is called mandibular fossa. Mandibular fossa and articular eminence are related to TMJ. A temporomandibular joint will be connected to the mandible to form the jaw joint. This opening is called external auditory meatus. And this process is called mastoid process, which is a part of the temporal bone. Mastoid process, external auditory meatus, mandibular fossa, articular eminence, zygomatic arch. If we rotate the skull like this, from the zygomatic process, okay, from this process, zygomatic process of the frontal bone, appear a line. This line is called temporal line. It begins as a single line and then divide into two lines. One is called superior temporal and one is called inferior temporal line. The superior temporal line fades, but the inferior temporal line continue to reaching the mastoid process and begin at the upper border of the mastoid process. At this part, it will be called Subramastoid Crest. And here is a triangle called McEwen triangle. McEwen triangle present between the Subramastoid Crest superiorly and anteriorly little posterior-superior border of the external auditory meatus, and here the imaginary line connecting the two lines together.